subject when you read it, but when it comes about the question, it is tricky. That's why you will see so many people will mark wrong answers. Okay, we will try to cover as much as I can. Of course, as if you're asking me personally, I will require 2 days to take the ENT class, but this is not the time. Okay, so we will take the basic ones and I will give the tricks how to solve the questions. That's it. Okay, first, whenever you are reading the ENT, first thing is to understand the meaning of the words which comes in ENT. Otherwise easy नहीं लगेगा. ठीक है, I will draw a diagram. Okay, this diagram is helpful till the end of the class. Okay, and at least year. What do we have in the outer side? Anyone? Yes, it is pinna, right? Pinna is followed by a S shaped. A S shaped. What is it? External auditory canal. This is our external ear. Okay, external ear. Then we have something called as ear drum. Dhol. Dhol of the ear is called as what? Dhol of the ear is called as tympanic membrane. Tympanic membrane, right? Then we have something called matchbox shaped. What is that? That is matchbox shaped. It is middle ear. Okay. Then we have middle ear, right? In this we have something called घुंघरू. क्या बोलेंगे हम इसे? घुंघरू. That is ear ossicle. Okay, 1, 2 and 3, right? 3 ear ossicles. क्या नाम होता है इनका? Malleus incus stapes. That is miss. Okay, Malleus incus stapes. It is followed by what? It is followed by inner ear. It is followed by inner ear. Inner ear के अंदर क्या होता है? We have what? We have cochlea. क्या है इसके अंदर? Cochlea. Right, we have cochlea. Cochlea is connected to brain with what? Brain से कैसे connected? By which nerve? Anyone? Yes, it is 8th nerve. Cochlea कैसे connected है? और inner ear is connected with the brain with 8th nerve. Okay, 8th nerve. Now, tell me the name of tympanic membrane. Tympanic membrane is also called as what? Myringus. क्या बोलेंगे हम इसे? Myringus. And middle ear is also called as tympanum. Simple words but confusing. It is called as tympanum. So tympanoplasty means a repair of middle ear. Okay. Myringoplasty means repair of tympanic membrane. Tympanic membrane, tympanum sounds similar, but they are not similar. Okay. Whole of the middle ear will be called as tympanum. Okay. ये इमेज याद हो गई? इमेज याद हो गई. Now remember, if any disease which is present in external ear to middle ear, external ear to middle ear will cause conductive hearing loss. Okay, conduction will be gone. Any disease sorry, which is involving inner ear and nerve will cause sensory neural hearing loss. Okay, इतना याद रखना है. I will ask this again and again. Okay, any disease which is involving external ear and middle ear will cause conductive hearing loss. Any disease which is involving internal ear will cause sensory neural hearing loss. I will ask this again and again. Reason being, ये आएगा पेपर. ठीक है, चल. Of course, I will not take the anatomy part. Reason being, ENT is vast, cannot be covered in 3 hours. Then we have something to examine ear. First one is otoscope. What do we have? We have otoscope. This otoscope is used by ENT people to look in the ear, and also this otoscope will be used by ophtha people to examine eye. Okay, that is otoscope. Okay, this instrument is called as Siegel's speculum. This is called as Siegel's speculum. Okay, yes, correct, Siegel's speculum. Where do we use? Many of you know this. Where do we use? We use it in fistula test. ये पता है सबको? And to look अंदर डाल रहे कान के, so what we will look? We will look at the ear drum. That is called as tympanic membrane or myringus, right? To look at myringus, right? That is to check the myringus and to give medication. Okay, this is a pneumatic otoscope. Pneumatic का मतलब होता है by this we will inflate करेंगे इसे, right? Pump करेंगे, so there will be air inside which is going inside the ear. Okay, so pressure in the ear will be increased. And one test more which we do by speculum. Anyone? That is Galley's test. Okay, for this we use Siegel's speculum. Can be remembered by the mnemonic, right? FMG for a medical graduate. Okay, your favorite mnemonic for medical graduates, right? For this we use this one. Then we comes to the tests, right? ये ग्राफ सबने देखा हुआ है, right? But you are not able to remember type A, AS, AD किस लिए use करते हैं. After this you will be able to remember. First tell me which frequency is used in tympanometry. Which frequency is used in tympanometry? Anybody know how many hertz? No? 220 hertz. Okay, 220 hertz is the frequency which we are going to use in tympanometry. What we will do? We will put this probe in the ear, and on the machine we will see the graphs. On the machine we will see the graph, right? Type A. Type A is normal. Type A is normal. Then comes S. AS. S stand for sclerosis. Which sclerosis we have in the ear? Yes, that is otosclerosis. A. D. 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 D stand for disrupted ossicle. इसका मतलब क्या हुआ? Damage to the malleus incus and stapes, right? Fracture, damage, right? ये थे type A. Then comes B, type B. Type B is seen in which disease? Anyone? इसी को हम बोलते हैं फ्लैट टिम्पैनोग्राम. कैसे याद रखोगे? बाय द न्यूमोनिक भरा हुआ. What is भरा? That is middle ear is filled, right? With what? पानी. भरा हुआ is seen in glue ear. It is seen in glue ear. Okay, glue ear में मिलता है. Glue ear में पानी भरता है middle ear में, right? Then comes type C. टाइप सी का मतलब होता है यूस्टेशन ट्यूब का गला दबा दिया है. यूस्टेशन ट्यूब इज चोक्ड. दबा दिया. हाउ इट इज गोइंग टू बी चोक्ड? बाय ब्लॉकेज, राइट? चोक्ड यूस्टेशन ट्यूब, राइट? ब्लॉकेज ऑफ यूस्टेशन ट्यूब, राइट? चोक्ड. These are your tympanometry. What do we see? We see tympanogram. टाइप सी को ही हम क्या बोलते हैं? Negative tympanogram. Okay, this was your recent question. Okay, they can give you the case from anything, and they can ask which tympanogram is seen. Okay, this was the examiner's favorite questions some exam before, so you should know it. A child with multiple probes. A child with multiple probe going on his head and in the ear is called as bera. क्या बोलेंगे हम इसे? Bera. Okay, bera, right? So what we are going to monitor? Brain evoked response. Okay, brain evoked response. So in this, remember, it is a first okay confirmatory test for hearing loss. Okay, but it is not a screening test. Screening test कौन सी है? That is auto-acoustic emission. Auto-acoustic emission. Single probe going in the ear with a monitor. Single probe going in the ear with a monitor is called as auto-acoustic emission. Okay. Bera कैसे है? One probe going in the ear and there are some probes attached on the forehead. ठीक है, याद रखना पड़ेंगे images. Images has been asked. Then we come to fistula test. What is fistula test? What we will do in this, we will take seagull speculum. We will take seagull speculum, right? We will increase the pressure in the external auditory canal. Okay, we will increase the pressure in the external auditory canal. If there is a fistula, okay, if there is a fistula, ऐसा समझ लो some kind of abnormality, if there is some kind of abnormality, patient will have nystagmus. ठीक है, patient will have nystagmus. जैसे ही हम कहां पर, if we are going to increase pressure in the external auditory canal by using what, by using Seagal's speculum, by using Seagal's speculum. ठीक है, true positive fistula sign, if there is a abnormality in the ear, okay, what will happen, patient will have nystagmus. So true positive means what, abnormality is present and patient is going to have nystagmus. Okay, now comes false positive, there is no much of abnormality, okay, but patient is going to have nystagmus, right? Last one, false negative means there is a fistula but no nystagmus. ठीक है, no nystagmus. And this is the diseases or deformities related to everything. True positive is seen in last. Okay, labyrinthine fistula, stapedectomy, and type 5 tympanoplasty. In this, we will see true positive fistula sign. Then comes Meniere's disease and congenital syphilis will cause Henneberg sign. Henneberg sign, that is false positive fistula sign. Okay, mnemonic is MC. At least remember this and this. Okay, false negative, dead ear or fistula is blocked by cholesteatoma. That means it is in CSOM, right? CSOM में cholesteatoma होता है, right? So you will get false negative fistula sign in this. You can remember by the mnemonic deaf. Okay, deaf. These are the some mnemonics. एक बार याद रखते हैं, बाद में भूल जाना है. Just remember this. Table is important. Even they can trick this with a case scenario. आने चाहिए, investigation is important in ENT. Then comes caloric test, bithermal test, और इसी को बोलते हैं Fitzgerald's Halbike test. Okay, what we will do? We will use water, either normal water, either cold water or warm water. What we are going to do? We are going to syringe the canal. Syringe the canal, right? For how much? कितने देर के लिए पानी छोड़ेंगे अंदर? Anyone? For 40 seconds. Okay, 40 seconds. If patient is going to have nystagmus, that means positive caloric test. Okay. Now remember one mnemonic, that is cows. Okay. Cold water. Okay. The deformities will be in opposite ear. If you are using warm water, the deformity is in same ear. Okay. Same ear में problem है. That is the meaning of this one. Right. Now, patient की tympanic membrane is gone, or patient is having rupture in the tympanic membrane. Of course, we cannot put water directly in the external auditory canal. Reason being, if the tympanic membrane is perforated, that water can go in the middle ear. From the middle ear, that water can come in the eustachian tube, and we can see even that water in the nasopharynx, right? So in this condition, what we will do, we will use air, perforated air. Okay, हवा देंगे हम, कौन सी? पानी वाली. by using this one. The name of this instrument is Dundas Grand Tube. इसी को बोलते हैं Dundas Grand Tube, used in caloric test for what? For tympanic membrane is perforation. Right? If tympanic membrane is perforated, we will use Dundas Grand Tube to do caloric test. Now tell me about first image. That is the mistake. First one is not boxer ear. Okay, it is not boxer's ear. It is pinna hematoma. Right? Of course, they will give you the history of boxing or some kind of fight, but that doesn't mean it is a boxer's ear. Okay, first patient will have hematoma in the pinna. Okay, यहाँ पे हेमाटोमा बनेगा, स्वेलिंग आएंगी, अंदर ब्लड जमा होगा, that is called as hematoma, right? If it is not treated, what I am saying, if it is not treated, then patient will have hypertrophy of the ear. Hypertrophy of the ear. Okay, and it look like a cabbage, right? Same goes over here. इसी को बोलते हैं हम बॉक्सर्स ईयर और कॉलीफ्लावर ईयर, राइट? समझे? इमेजेस अलग है, डू नॉट रन फॉर द आंसर्स. दिस इज बॉक्सर्स ईयर्स और इसी को बोलते हैं कॉलीफ्लावर ईयर. पिन्ना हेमाटोमा की ट्रीटमेंट क्या होंगी? पिन्ना हेमाटोमा की ट्रीटमेंट क्या होंगे? Incision and drainage, remove that hematoma, right? Yes, IND, correct. Take a look over here. It is raised but not so red in the color, right? Not so red in the color. Okay, not so red in the color. But now comes redness on the external ear, except one part of external ear, that is this part, that is called as lobule. Lobule पे redness नहीं है. What is the disease? You know this, I know that. Yes, it is called as perichondritis. Reason why this part is not involved, because it contains fat. It contains fat. Okay, it do not have a cartilage. If cartilage was present in the lobule, this should also involve. So it is a disease of cartilage, that is called as perichondritis of pinna. Okay, most common organism causing perichondritis is jhuti mona, that is Pseudomonas. Pseudomonas is the most common organism causing perichondritis of pinna. Okay, क्या involved नहीं हो रहा? Lobule is not involved. Patient presented with pain in the ear, and as soon as I touch the tragus, this small part of the ear, as soon as I touch the tragus, there is more pain. There is more pain. On the otoscopy, there is a small comedone or a swelling. इमेज इज गिवन, इसी को क्या बोलते हैं हम? लोकलाइज्ड ओटाइटिस एक्सटर्ना, पेन ऑन टचिंग द ट्रैगस इज कॉल्ड एज, क्या बोलेंगे हम इसे? इसको टच करने पे क्या हो रहा है? पेन हो रहा है, इसको बोलते हैं हम ट्रैगल साइन, ट्रैगल साइन, राइट? ये क्या हुआ है? वी हैव अ फरंकल, right? It is furuncle. Most common cause of furunculosis, anyone? Even all over the body. Staph aureus. Okay, Staph aureus is the most common cause for furunculosis all over the body. Staph. क्या हो रहा है? Pain on touching the tragus. It is called as tragal sign. ठीक है? Though it will not cause hearing loss, but चलो examiner ने दे दिया. Which hearing loss will be seen in localized otitis externa? I told you, remember the first slide. External ear and middle ear, conductive hearing loss. Yes, correct. Right? Inner ear, sensory neural hearing loss. Right? Sure. These patients comes every day in the OPD. Okay? Automycosis. Patient को क्या होगा? Foreign body sensation in the ear with decreased hearing loss. Right? Decrease in hearing. That is called as hearing loss. ये मिलेंगे इसके अंदर, right? पहला है, if you will take a newspaper, right, newspaper and put it in the water, how it will look? Black white, black white. Same we will see it over here. इसी को हम बोलते हैं wet, क्या बोलेंगे? wet paper appearance. Okay, wet paper appearance. Most common cause क्या है इसका? Anyone? Aspergillus niger. Aspergillus niger is the most common cause of this. Whitish fungus in the external ear is called as, कौन सी होती है? It look like a cotton ball, right? कौन सी होती है? That is, yes, Candida. Okay, एक क्वेश्चन पूछू साइड बाय साइड. मोस्ट कॉमन फंगल इन्फेक्शन seen in COVID. आंसर करना, देन आई विल आगे बढ़ते हैं. A patient presented with decreased hearing loss. Okay, decrease in hearing. Okay, decrease in hearing, and there is a growth inside the external ear, and he used to serve in the sea water. He used to serve in the sea water. What is the diagnosis? Okay, and this hearing is bilateral. Hearing loss is bilateral. Okay, surfing in the sea water is called as actually surfer's ear. क्या बोलेंगे हमसे? Surfer's ear. Okay, what is going to happen over here? There will be exostosis. Okay, exostosis of bony part of external auditory canal. Okay, क्या हो रहा है इसके अंदर? Exostosis. And as I said, it will be bilateral. ये क्या होगा? It will be bilateral. ठीक है? Yes. कोविड में मोस्ट कॉमन फंगल इन्फेक्शन इज कैंडिडा. ओके, नॉट म्यूकर, नॉट एस्परजिलस. रीजन सबके मुंह में प्रेजेंट है. ओके, सबके मुंह में है. इट इज कैंडिडा, नॉट म्यूकर माइकोसिस, नॉट एस्परजिलस. Then there is one more image. Remember, if you are seeing a bony outgrowth, okay, bony outgrowth, that too single, unilateral, is called as osteoma. Okay, unilateral होता है. कैसे होगा? Unilateral. It is a tumor of bone. Osteoma, oma लिखा है ना, right? So how you will see exostosis even in the single year, it is not going to happen a single dot. एक ही नहीं होगा इसके अंदर. There will be multiple. It is a protective mechanism of the ear to protect the ear. Reason, patient is going to serve in the cold water. ठीक है. सिटीज पूछे जाती है ईएनटी के अंदर. So what you will see, there will be bilateral bony growth in both the ear. There will be bilateral bony growth in the both ear. In osteoma, take a look. This external auditory canal is clear, but over here there is only one single bony growth. Okay, one single bony growth. ठीक है, आ गया समझ? If CT comes, take a look. The external auditory canal has a growth in both the ear. Patient presented with pain in the ear, okay, and decreased hearing loss, plus there is bulla on the tympanic membrane. Bulla on the tympanic membrane is called as bullous myringitis. This image has been asked, that too recently. What are the causes of bullous myringitis? First one is mycoplasma. Second, influenza. And third one is strep pneumonia. Strep pneumonia. These are the causes. Yes. Okay. Try to answer this question. This question has been asked at least 2 times. What do you think? A patient presented after being slapped for 3 days, decreased hearing loss and pain. Take your time and try to answer. Patient is presenting with after 3 days, right? After 3 days. So answer over here is wait and watch. Okay, wait and watch. Okay, I will change the question. Patient is presenting after 7 days. Patient is presenting after 7 days. What will be the answer? Patient is presenting after 1 month. What will be the answer? Remember, till 3 month, till 3 month. Till 3 month, management will be conservative. Okay, management will be conservative. Reason being, tympanic membrane can heal by himself. Okay, for example, suppose ये था tympanic membrane perforation. Okay, after some time, this will be the picture. Okay, tympanic membrane trying to heal by himself. So no need to give anything, right? But if the patient comes after 3 months, right? As I said, you will get confused between tympanoplasty and myringoplasty. Answer is myringoplasty, right? A repair of tympanic membrane is called as myringoplasty. A repair of middle ear is called as tympanoplasty. ठीक है, अपोजिट है. Try to answer this question. A elder patient presented with uncontrolled diabetes came with pain and greenish black discount. Okay, greenish black discount. I will give you the one mantra. Uncontrolled diabetes. Okay, whenever patient examiner is going to write down uncontrolled diabetes, most of the time the organism which is going to cause the infection is going to be pseudomonas. Okay, pseudomonas question always every time with diabetes. And what does pseudomonas causes in external ear and middle ear? That is malignant otitis externa. ठीक है, malignant otitis externa. That's it. समझ आ गया? Still, greenish black discharge. What is the meaning of this? That pseudomonas is eating bone of the ear, bone of the ear, and that dead bone is coming out of the ear. How? Take a look over here. Now tell me which is the abnormal site in this? Anyone? Okay, I will give you the number. No. चलो, confusion ही confusion है. Take a look over here. This is external auditory canal. External auditory canal. This is mastoid. Okay, this is mastoid. Mastoid will look honeycomb appearance. क्या मिलेगा इसमें? We will see honeycomb appearance. ये दिख रहा है? ऐसे नहीं लग रहा मधुमक्खी का छत्ता. And you will be able to see external auditory canal clearly. Now take a look over here. Over here, you are able to see external auditory canal. Okay, but take a look over here. Where is the part, rest of the part of external auditory canal? No, the bones are gone, right? So abnormal site is this one. What has happened? Bone बाहर आ रहा है ना, blackish greenish color discharge, right? So this is seen in malignant, yes, malignant otitis externa. Okay, this infection can go in the middle ear as well. उसको कब क्या बोलेंगे हम? Malignant otitis media. Okay, malignant otitis media. Right, most common cause क्या है इसका? Of course, it is Pseudomonas. Seen in who? Uncontrolled diabetes, right? Immunocompromisation of any kind, right? Patient is taking, for example, chemotherapy. ना? Patient cancer का है, immunocompromised है, right? So over there also we will be able to see. Camel rice में what we are getting? Discharge from ear with what? Granulation, right? With granulation. And there is one specific feature of pain. Pain at night. Patient will have ear pain at night. ठीक है? इन्वेस्टिगेशन ऑफ चॉइस क्या है इसकी? यही तो कयामत है. Though you will get the image of CT scan, but remember, investigation of choice is technetium 99 bone scan. Okay, technetium 99 bone scan. If patient is with pseudomonas infection, remember this. This is no more a OPD based case. Okay, OPD नहीं. Patient will go in sepsis first. ठीक है, patient we have to admit this patient, and if it is the infection of bone, other bone can also involve, right? So we have to do whole body bone scan. Okay, that is technetium 99 bone scan. Okay, some of you or if you had a family member who had a cellulitis and diabetes patient, right? Pseudomonas is diagnosed. Pseudomonas can come again in other part of body part, right? Cellulitis एक जगह था, दूसरी जगह हो रहा है. So Pseudomonas is a very dangerous organism. As soon as you will detect that patient is with Pseudomonas, that patient will already will land in the ICU. Okay, ICU के अंदर मिलता है. ठीक है, this patient we have to admit because most danger is sepsis. Patient can die of sepsis, right? ठीक है, चले आगे समझ में. ट्रीटमेंट पे क्या देंगे हम? थर्ड जनरेशन cephalosporins. Okay, before giving any kind of antibiotic, what we need to do? Basic question. Before giving antibiotic, what we have to do? And try to solve this question with that question. Microbiology question है तुम्हारा. Whenever we are going to give antibiotic to a patient which is serious, of course, we will do blood culture sensitivity for the drugs. Culture sensitivity करेंगे. We will check that antibiotic is going to act on the organism or not. Sensitivity है या resistance है. Patient with pain in ear, throat and URTI, upper respiratory tract infection. Patient is having a red bulge out tympanic membrane. Okay, what is this first? Patient came with acute pain in ear, throat and URTI. First, tell me the diagnosis. It is acute suppurative otitis media. Okay, patient had URTI. From that URTI, the organism went in the ear, and they have started causing infection in the middle ear. So it is acute suppurative otitis media. Now what they are saying, red bulge on the tympanic membrane, or bulging out of tympanic membrane with redness. कौन सी stage? Which stage? It is pre-suppuration stage. उसका मतलब है patient is having water inside, which is causing tension on the tympanic membrane. Because of that tension, patient is having redness on tympanic membrane and ear pain as well. So in this stage, what we will do, we will make a hole on tympanic membrane, that is called as myringotomy. Myringotomy. क्या होता है? Why I have given you the history of URTI only? See, our middle ear, tympanic membrane, our middle ear is connected with a tube. Is connected with a tube, right? Eustachian tube. This eustachian tube कहाँ open होती है? It opens in nasopharynx, right? Nasopharynx, sore throat. What happens from here? The organism, upper respiratory tract infection, will go inside. कहाँ पर आएंगे? It will come in the middle ear. Okay, because the organisms are so many, this tube will get blocked. Okay, this tube will get blocked. Negative pressure होता है middle ear में पहले ही. Now this tube is blocked by organism. Suppose अब क्या होगा? यहाँ पर भी तो organism है. Okay, they are going to form pus, पानी, right? Infection है, पानी होगा, right? Antibodies, our antibodies will act, macrophages will act on that infection. क्या होगा? यहाँ पर पानी भरेंगे, and this eustachian tube is blocked, so the drainage system is gone. So what will happen? Ultimately the water will be over here, and this is going to put a pressure on tympanic membrane, and that tympanic membrane will bulge out. क्या होगा? बाहर के तरफ निकलेंगे. Reason? There is no drainage system. Okay, this is acute suppurative otitis media. Whenever you are getting question on ASM, always, what I am saying, आएगा. Sore throat लिखेंगे और कफ कोल्ड लिखेंगे, right? Features of ऊपर का throat infection, right? With pain in the ear, that too acute. क्या है वो? ASOM है. ठीक है. So पहले स्टेज क्या थी? The organism will block this tube, right? The organism will block this tube. This is called as tubal blockage. कुछ organism इसके अंदर आ गए. Now they will form water inside, right? They will form water inside. Tympanic membrane क्या होंगी? Bulge होंगी. Okay, bulge हो गई. There will be tension on the tympanic membrane. There will be tension on the tympanic membrane. Reason being, there is a collection of fluid in the middle ear. क्या होगा? इसी को हम बोलते, you have studied this, red bulged out tympanic membrane, right? यही पे मिलता है. Now there is a tension on tympanic membrane, and we do have vessels on it. What do we have? We have vessels on it. So what will happen? That vessel will dilate. Tension बढ़ा है, तो वो vessel की size भी बढ़ेगी. Okay, and how it will look? जो तुमने बचपन में देखा होगा इन द विलेजेस, बैलगाड़ी का पहिया। के बैलगाड़ी का पहिया। के एंड डायलेटेड वेन्स। डायलेटेड वेन्स, इसी को हम बोलते हैं, व्हाट डू वी कॉल इट? कार्ट व्हील अपीयरेंस। This is called as cartwheel appearance. Treatment over here is myringotomy. We will put a hole inside, right? Now, जो टेंशन यहाँ पे बढ़ा था, now it has increased. Increase हो गया, increase होते रहा. What has happened? This tympanic membrane got ruptured. This tympanic membrane got ruptured. उसी को हम क्या बोलते हैं? Suppuration stage. क्या बोलेंगे इसे हम? Suppurative test, right? Now tell me most common site of suppuration or tympanic membrane rupture in ASOM. How do we divide tympanic membrane? We divide it like this. Okay. Anterior superior, anterior inferior. आगे की साइड वाले. Okay. Our ear is tilted. टेढ़ा है ऐसे. Okay. टेढ़ा है. So this bow down side is actually front side. Okay. Front side होती है आगे की तरफ की. So it is anterior inferior, superior inferior, posterior in superior and posterior inferior. Most common site of tympanic membrane rupture, yes, it is anterior inferior. इसी को बोलते हैं quadrant. Okay. So what will happen? There will be pulsatile discharge. Okay, pulsatile discharge. What will happen? अंदर हवा नहीं है. There is no air anymore. Reason? Restriction tube is blocked. So some pus will go out, some air will come inside, some pus will go out, air will come inside. क्या होगा? Pulsation type discharge. इसी को हम बोलते हैं pulsatile discharge. Pulsatile discharge. Please mute yourself. Okay, इसी को बोलते हैं pulsatile discharge. ठीक है. और इसी को बोला जाता है रिजर्वायर साइन. रिजर्वायर का मतलब क्या होता है? देयर इज वन रिजर्वायर. पानी की टंकी है, वहां से पानी बाहर आ रहा है. वाटर इज कमिंग आउट ऑफ अ टैंक, राइट? सो वो क्या हुआ? रिजर्वायर फॉर द वाटर. सेम ओवर हियर, रिजर्वायर फॉर द फ्लूइड, इन्फेक्टिव फ्लूइड, मिडल ईयर. वहां से क्या हो रहा है? पानी बाहर आ रहा है, वाटर इज कमिंग आउट. सो इसे बोलेंगे हम रिजर्वायर साइन, राइट? और लास्ट चीज कौन सी होती है? रिजोल्यूशन. ओके, resolution. The complete ASOM features will go out and patient will have resolution. Normal life again in the middle ear. Okay, ठीक है. क्या ट्रीटमेंट देते हैं हम? एंटीबायोटिक देंगे, डिकंजेशन देंगे एंड सिम्टोमेटिक मैनेजमेंट. फॉर एग्जांपल देयर इज पेन, पेन किलर्स देंगे, राइट? मायरिंगोटॉमी कब कर रहे हैं हम? व्हेन वी विल डू मायरिंगोटॉमी? व्हेन देयर इज अ प्री सपोरेटिव टेस्ट स्टेज, राइट? कहाँ करेंगे? इफ यू रिमेंबर, मोस्ट कॉमन रप्चर साइट कौन सी है? Is this one, right? That is the natural site of rupture. So of course we will not disturb the natural site of rupture. Reason being ASO वापस भी हो सकता है लाइफ में. So what we will do over here? We will use other site. Okay, this side. That is कौन सा है? Down and posterior. This side will be used for rupture. कहाँ कर रहे हैं हम मायरिंगोटॉमी? That is going to happen in posterior inferior quadrant. ठीक है. कब यूज करेंगे? इन रेड bulged out tympanic membrane pre-suppurative stage. Patient is having decrease in hearing loss from 1 month. Decrease in hearing from 1 month. On the examination, there are bubbles present in the ear. On the examination, there are bubbles present in the ear, middle ear, and patient is having difficulty in breathing. Patient is having difficulty in breathing. क्या आंसर होगा? आंसर एक्चुअली सामने है, glue ear. Glue ear. Glue ear. How? I will just, we will draw the same diagram again. Middle ear connected with what? Eustachian tube. कहाँ पर? In the nasopharynx. Nasopharynx में connected होता है, right? Now patient is having a mass. Where? Patient is having a mass in the nasopharynx. For example, nasopharyngeal carcinoma. Okay. If anybody knows what is the function of eustachian tube, maintain the pressure in the middle ear as well as drain the middle ear. Okay. Drain the middle ear. Now what has happened? This drainage system is blocked by, not by organism this time, it is blocked by a mass. Now whatever fluid we should drain from the middle ear in the nasopharynx is not going to go out. Okay, it will be the slow procedure, right? So it will take a more time, right? It will take a more time. But यहाँ पे क्या हो रहा है? Drainage हो रहा है? No. So slowly there will be fluid connection. Okay, fluid तो है, but इसके अंदर bubbles भी होंगे. Reason being, middle ear is a hollow organ. इसके अंदर air normally present होती है. So we will see some bubbles which is hanging in the fluid, right? So there will be multiple bubble with a clear fluid. Okay, multiple bubble with a clear fluid. Causes क्या क्या है? If it is going to happen in children, what will be the cause? You study one disease. The name of that disease is adenoid hypertrophy, right? Adenoids get increased in size in the childhood age, right? Adult में क्या होगा? That is nasopharyngeal carcinoma, right? Nasopharyngeal carcinoma में क्या होता है? It will be of course on the one site. Fossa of Rosenmuller is situated near the eustachian tube. Over there we will have it on the एक side में होगा. But adenoids will be increased in the nasopharyngeal backside के wall पे होता है adenoid. So that will going to block this eustachian tube also and this eustachian tube also, right? So there will be bilateral glue here. What we will have? We will have bilateral glue here, right? ये थी एक इमेज, मल्टीपल बबल. नाउ अगर हम कहीं पर पानी रखते हैं बहुत दिन, if we are going to keep a water for so many days, what happens to that water? पानी गाढ़ा होते जाता है, right? Shrunk होते जाता है, right? Over here also what will happen? पानी गाढ़ा होते जाएगा. The concentration in the water will increase. There will be loss of fluidity. So if I will put a torch, it will look like a dulled tympanic membrane with loss of reflex. Okay, dull tympanic membrane with loss of reflexes will be seen. What is the treatment? Like ASOM, we are not going to have a natural opening in the tympanic membrane, right? Rupture of tympanic membrane is not going to happen. But what is the primary goal of ट्रीटमेंट इन ग्लूयर? अभी तक क्वेश्चन में एक ऑप्शन आ रहा है, आई कैन bifurcate that in two option. How you will decrease the pressure? By removing this disease, right? By removing this disease, we will decrease the pressure, है ना? पानी वापस आने लगेगा. So what is the primary goal? Treat the cause first. Okay, treat the cause first. That is the first line or must do. तुम्हारे पेपर में क्या आता है? Dectomy. Okay, if it is given as a separate option, you have to mark adenidectomy or treat the cause. Okay, then afterward, if we have treated the adenidectomy, then we will do myringotomy. Plus, what we will do? We will put a grommet. Grommet is nothing. It is a small button-shaped tube which we will insert. Where do we insert myringotomy? Where we insert grommet and do myringotomy? The answer over here is changed. That is upper anterior inferior quadrant. Okay. Now, if they will give you both as a separate option, okay, if they will give you both separately, mark this answer. Okay. If you're not going to treat the cause, how glue air will stop, right? There will be fluid accumulation again and again. So mark this. Okay, if it is coming together, that is the best answer. If it is coming together, that is the best answer. But separate आया तो कौन सा? और आ चुका है. ओके, आ चुका है. ठीक है, करना है. ASOM, CSOM and glue air are the most important topic from the year. So I am taking a little bit slow. Then comes CSOM, chronic suppurative otitis media. Okay, there are two types. Tubotympanic, okay, tubotympanic and atticoantral. Atticoantral. If we will draw a diagram, how many of you know middle ear cleft? We have what? We have mastoid with the largest air cell. इसी को हम बोलते हैं antrum, right? Antrum. Where does it open? It opens by a door. Door होता है between middle ear and mastoid air cells. कौन सा डोर होता है? And it is connected to middle ear. It is connected to middle ear. Okay, समझने के लिए डायग्राम निकाल रहा हूँ, इसको लिटरली मत लेना. Okay, it is connected to middle ear and middle ear is connected with eustachian tube. इसको सबको बोलते हैं मिलके middle ear cleft. The door between mastoid cell and tympanic membrane is called as adytus. यहाँ पे क्या है? Adytus. Okay, and if you remember, middle ear is divided into three parts. The upper part of the middle ear is called as what? Anyone? No one? Attis. नाम खतरनाक है. Then we have mesotympanum and this one is hypotympanum. This is our eustachian tube. Tubotympanic. इसका मतलब क्या हुआ? ट्यूब कौन सी है हमारे पास? there is only one tube, eustachian tube plus tympanic membrane is involved. It will be called as tubotympanic or safe CSOM. Okay. Atticoantral. Atticoantral means attis and the mastoid or antral, largest air cell of mastoid is involved, is called as unsafe CSOM. ठीक है, नाम लिखा है, पता नहीं होता कि किसको क्या बोलना है. ओके, यू नीड टू रिमेंबर this modified radical mastectomy or myringoplasty or tympanoplasty, right? इतना याद रखो. Now question is not going to come on CSOM. Question actually comes on complications of CSOM, and believe me, these complications के नाम एक word से change होता है. Answer will change by a single word. Okay, किससे होगा? Single English word. This is the most trickiest part in entire ENT. Okay, पेशेंट क्या लिखेंगे उसमें? पेशेंट विल प्रेजेंट विथ स्कैंटी फाउल डिस्चार्ज. ओके, पेशेंट is having ear pain, scanty foul discharge with Pasterski and Brudzinski sign positive. What is the diagnosis? Discharge from the ear for a month, for example, chronic है, with Pasterski and Brudzinski sign positive. What will be the answer? कि easy नहीं है पेपर, ये ट्रिकी पार्ट है. Pasterski and Brudzinski sign with air discharge. Air discharge, scanty, purulent, foul smelling discharge, and there is a discoloration present on the upper part of tympanic membrane. उसी को हम बोलते हैं cholesteatoma. Present in hypotympanum, attis, present in upper part of ear. Answer is meningitis. Answer will be meningitis. Pasterski and Brudzinski sign positive आ रहा है, right? It is a complication of CSOM. Okay, patient presented with scanty, purulent, foul discharge, discoloration present on the upper part of tympanic membrane, and now patient is having disorientation. And surgeon, the ENT guy has advised CT scan to rule out what? And this was your exam question. Patient is having abscess. Okay, patient is presented with abscess, right? Disorientation होगा, involuntary movement of hand and limbs can be there, right? कुछ भी हो सकता है. रीजन भी नर्व इन्वॉल्वमेंट हो गया एब्सेस के अंदर, थ्रो कर रहा है, सीजर्स थ्रो कर रहा है, राइट? पेशेंट इज हैविंग सीजर्स, सो आंसर विल चेंज. द आंसर इज एब्सेस. ओके, इट इज आल्सो अ कॉम्प्लिकेशन ऑफ सीएसओएम. ठीक है, आ गया समझ में? We will go one by one for the rest of the sorry, very sorry. Most common complication will be anyone? Most common complication overall, it is mastoiditis. Most common intracranial complication will be, why patient is going to have a brain part involved? If you remember, middle ear is connected with the brain फ्रॉम द अपर वॉल, यहाँ पर ब्रेन है, ओके, अपर वॉल से ब्रेन कनेक्टेड है, सो पेशेंट विल हैव सिम्टम्स ऑफ ब्रेन इन्वॉल्वमेंट इजिली। एक वॉल ही तो है बीच में दोनों के। इंट्राक्रैनियल कॉम्प्लिकेशन विल बी meningitis, most common damage is incus, okay, incus, okay, अगेन सेम वो स्टोरी देंगे सीएसओएम की, सीएसओएम स्टोरी विद, एक याद रखना, whenever you are getting question on lateral sinus thrombophlebitis, whenever you are getting question on lateral sinus thrombophlebitis, they will add the features of fever, okay, features of fever, okay, they will add features of fever with what, papil edema, edema on the, कहाँ पर, आंख में, एडेमा कहाँ पर होगा, आंख में, सो देयर विल बी ब्लरिंग ऑफ विजन, राइट, पैपिल एडेमा हुआ है, ब्लरिंग ऑफ विजन होगा, सो दिस आर द हिंट टू कैच lateral sinus thrombophlebitis, okay, lateral sinus thrombophlebitis. CT scan आया, if CT scan comes, remember this part, either this will be hollow, okay, either this part is hollow or it is filled, whitish दिख रहा है, okay, this is called as empty delta sign on CCT, and if it is filled with whitish, मतलब उल्टा हो जाएगा, यहाँ पर white दिख रहा है पूरा, that means it is delta sign on CT scan, okay, और एक अच्छा फीचर इसका है, क्वेश्चन देखो बना के देता हूँ, ठीक है, पेशेंट फाउल स्मेल, discoloration present on the upper part of ear with edema on mastoid, अब सबको क्या लगेगा, आंसर इज mastoiditis, नो, आंसर इज lateral sinus thrombophlebitis, रीजन, एयर इन्वॉल्वमेंट भी उसने लिखी है उसके अंदर पूरी की पूरी तरह, ठीक है, आ गया समझ। देन कम्स पेशेंट प्रेजेंटेड विथ foul smell, scanty foul smell, discoloration present on the upper part of tympanic membrane with vertigo, with vertigo, okay, patient is having vertigo, so answer is labyrinthine fistula, okay, labyrinthine fistula, patient present ear pain, scanty foul discharge with discoloration on the upper side of tympanic membrane with double vision, with double vision and ear pain, eye pain, answer is changed. It is Gradin-Gos syndrome, okay, blurring of vision कहाँ मिलेगा हमें, in this, but we are not going to see double vision, double vision कहाँ मिलेगा, Gradin-Gos syndrome, okay, CSOM का एक history है, one question will be there, okay, you can remember by the mnemonic rod, retroorbital pain, otorrhea and diplopia, okay, what we are going to see, redness on the mastoid, इसी को हम क्या बोलते हैं, someone has used iron on the mastoid, if we will put iron on mastoid what will happen, redness, so इसी को बोलते हैं iron out mastoid, iron out mastoid, investigation of choice, anyone, It is not city, it is CECT. Okay, contrast enhanced city. City का मतलब होता है NCCT. Okay, it is CECT. I have shown you the image of normal mastod. It will be honeycomb, right? Honeycomb appearance. But in mastocytitis, what will happen? There will be infection, right? There will be infection. So what will happen? It looks like there are so many clouds present over here, right? ऐसे दिख रहा है? This is called as clouding of mastoid. क्या होगा यहाँ पर? Clouding. Clouding of mastoid. Okay, clouding of mastoid will be seen. ठीक है? What is the complication? Most common complication of mastocytitis? Anyone? Most common complication is abscess. Okay, most common complication is abscess, right? Most common site is post oral. Post oral का मतलब होता है behind the ear. Behind the ear there will be abscess, and there are two specific abscess. One is called as Bisolt's, and other name is Syphilis. Bisolt's abscess will involve which muscle? It will involve sternocleidomastoid muscle. नाम में ही है mastoid, right? And Syphilis abscess will involve digastric muscle. Remember by the mnemonic BCCD. B, S, S similar sound करते हैं, right? C and digastric. BCCD. याद ऐसे कर लो, ऑटोमेटिकली आंसर आ जाएगा. वन लाइनर जब आएगा पढ़ने की भी जरूरत नहीं. BCCD बस याद रखना. ठीक है. Redness on the mastoid, what we have called is iron out mastoid, right? इसमें मिलता है mastoiditis, right? Bluish discoloration on the tympanic on mastoid is called as battle sign. कहाँ मिलता है? It is seen in middle cranial fossa fracture. Middle cranial fossa fracture. Anterior, middle, posterior होता है the middle cranial. Middle cranium में भी कौन सा bone fracture होगा? That is temporal bone. Temporal bone fracture. Yes, correct. इसे कैसे याद रखना है? There is redness pulsatile mass present in the lower side of tympanic membrane. Always answer is going to be glomus tumor. Redness present है कहाँ पे? On the lower side of tympanic membrane. ये ऊपर की साइड होती है. On the lower side of tympanic membrane, right? क्या बोलते हैं इसको? This is called as a rising sun sign. Rising sun sign कहाँ मिलेगा? It is seen in glomus tumor, right? Glomus tumor. Most common site in ear कौन सी है? That is middle ear. But most common site of glomus tumor overall, anyone? Answer is nail bed. Okay, nail bed होता है हमारे यहाँ पर, right? Over here, that is the most common site of glomus tumor. Okay. There are so many signs named in the ENT. You can remember glomus tumor signs by using one mnemonic. Right atrial BP, RABP. Okay. There was a famous question. Brown sign is seen in which disease? Brown sign is seen in which disease? क्या हो रहा है? कौन सा क्या आंसर होगा? ग्लोमस ट्यूमर. If you are not able to remember this mnemonic, at least remember GB road. GB road क्या होता है मत पूछना. Okay, goes for glomus. Okay, GB road, famous area in Delhi. Phelps sign क्या है? On the city, inability to distinguish between ICA and jugular bulb. Now take a look over here. Okay, there is clear differentiation. There is a line between bulb and internal carotid artery. Okay, there is clear differentiation between both. But Phelps sign. Now tell me how to differentiate. Right? There is no clear wall between both. Right? There is no clear wall between both. So this is your Phelps sign, and this city has been asked. Inability to distinguish between internal carotid artery and jugular bulb. इसी को हम बोलते हैं Phelps sign. ठीक है. ब्राउन साइन क्या है? सीगल स्पेकुलम, जो इमेज हमने देखी थी. राइट. इफ यू विल increase the pressure in the canal, this red part will become white. Okay, ये लाल सफेद दिखना चालू हो जाएगा. रीजन प्रेशर आ रहा है उस पे. That is called as brown sign. Okay. Examiner's favorite. Young pregnant female. Young pregnant female with bilateral progressive hearing loss. Answer, yes. The answer always going to stay autosclerosis, and this is the way they will ask the question. Okay, progressive pregnant females में ही मिलेगा. Right. What are the signs that we see in this? First one is Carhart notch. Carhart notch. क्या होता है Carhart notch? Yes. See, it was going normally and there is a sudden dip on 2000 hertz. Dip आ गया, right? Dip आ गया यहाँ पे. Sudden dip at the 2000 hertz is called as Carhart notch, right? Carhart notch. Then comes paraacusis. Paraacusis welchi. Paraacusis welchi or paraacusis wilsi, whatever you want to say. What is the meaning of that? Generally, women's shouts, right? Generally, women's shouts, right? Now, God has given them a disease when they will hear better only in shouting. They will hear better in only in shouting. ठीक है, बदला. क्या नाम है उसका? Paraacusis welchi. Hears better in noisy environment. ठीक है, noisy environment, right? और नाम भी खतरनाक है और एक, है ना? We boys don't know how many colors are there, but there is one specific color which I am not able to understand. The name of that color is called as flamingo pink. है ना? I know only one pink because I am a boy. Flamingo pink tympanic membrane is seen in disease associated with young pregnant female. इसी का नाम है Schwartz sign. Okay, flamingo pink tympanic membrane. Right? Treatment. Treatment is stapedectomy. Why we will remove the stapes? Reason being the autosclerosis is going to happen on the foot of stapes. Okay, on the foot of stapes, foot process of stapes. So we will remove the stapes. Okay, we will remove this stapes और एक spring डालेंगे अंदर छोटी सी to act as a stapes bone. Okay, इसी को बोलते हैं stapedectomy. Okay, young pregnant female था. Now comes a old people. है ना, बस फीमेल को ही क्यों तंग करेगा भगवान. Now has the turn for the guy. Middle age guy presented with vertigo, tinnitus, hearing loss. Okay, patient presented with vertigo, tinnitus. Okay, and as soon as there is a loud voice, patient will have vertigo and patient collapse. The name of the disease is Meniere's disease. ठीक है, Meniere's disease. Middle aged, vertigo, tinnitus, hearing loss. Answer is always going to stay as what? Meniere's disease. Actually, this is the classical triad of Meniere's disease. What is the Meniere's disease? Inner ear, some part of the inner ear is going to drain in the endolymphatic sac. Okay, endolymphatic sac में drain होता है. In the Meniere's disease, this endolymphatic sac is not working. Because of this, we are going to have Meniere's disease. What happens in Meniere's disease? नाम सुने होंगे, diplacosis, right? D means double. Double का मतलब होता है two sounds we will heard. Then comes Tullio's phenomena. What will happen? As soon as he will hear a voice, loud voice, there will be vertigo. There will be vertigo. Now comes Tumarkin crisis. What is the meaning of Tumarkin crisis? Loudness क्या कर रहा है? Vertigo, right? Due to vertigo, there will be sudden fall. Then comes Hennebert sign. Hennebert sign कहाँ मिल रही थी और एक जगह? That was syphilis, right? Yes, false positive. Fistula sign. False positive fistula sign. Recruitment phenomena. Recruitment होती है, right? Army recruitment, doctors recruitment, right? Employees recruitment. So now our loudness, that is due to vertigo. Vertigo cause कर रहा है. Loudness क्या कर रहा है? Vertigo cause कर रहा है. Now this loudness will produce more loudness. इसका मतलब क्या हो रहा है? तेज आवाज will increase the तेज आवाज, right? Loud आवाज will create more louder sound in the ear, right? So this patient will have vertigo again and again, again and again, again and again, again and again. Reason? Loudness increase होते जाएगा, so vertigo will also increase, right? Until what? till patient falls. Okay, till patient falls. You can use the mnemonic if you want. The mnemonic is direct to home, that is DTH. Recruitment, man. Man stands for Meniere's disease. Diplococcus, Tullius phenomena, two marking sign, Hereward sign, recruitment phenomena is seen in Meniere's disease. Right? Investigation of choice. Anyone? It is electrocochleography. Electrocochleography. Treatment. Problem कहाँ था? It was in endolymphatic sac, right? It was in the endolymphatic sac. So treatment is endolymphatic sac decompression. Endolymphatic sac decompression. This is the treatment. Patient presented with vertigo. Okay, patient presented with vertigo. No other features are given. No other features are given. Remember, most common cause of vertigo is BPPV. Most common cause of vertigo is BPPV. Okay, right? BPPV. What happens? Take a look over here. This part in the sacral, utricle, and vestibule. In sacral, utricle, vestibule, what we have? We have something called as otolith. Otolith. Okay, there are small particles, nanoparticles. Okay, there are small particles which are present. Okay, by some chance, okay, this छोटे particle, this otolith from sacral, utricle, and vestibule comes in semicircular canal. Semicircular है ना, हाफ हाफ होते हैं, ठीक है. सेमी का मतलब होता है हाफ. Comes in semicircular canal. Okay, as soon as this particles comes in semicircular canal, patient will have vertigo. Patient will have vertigo. So what is the treatment or what is the investigation? Take that otolith from this semicircular canal back into sacral, utricle and vestibule. Right? क्या नाम है टेस्ट का? That is Dix Hallopike manure. Right? Treatment क्या है? Applies manure. Do we need to give anything? No. Otolith बाहर गया, उसे वापस लेके आओ. Right? So vertigo will decrease. That's it. This is the treatment. Okay. Recent question. Patient presented with deviation of mouth. ये कौन सी साइड होती है? This is left side. This is right side. Patient presented with deviation of mouth toward left side. Okay. Toward left side. Which palsy? कौन सी palsy होंगी? The palsy will be present on the right side. Okay. यहाँ पर problem है. Okay. Only there is deviation of mouth and numbness. Okay. Numbness हो सकता है, pain हो सकता है. It is called as Bell's palsy. Bell's palsy. कौन सा लीजन होता है? This is lower motor neuron lesion element. Now, patient presented with lower motor neuron lesion with क्या बोल रहा हूँ? With element plus rashes. Okay, rashes. or bullous on tympanic membrane. Rashes कहाँ पे? On the cheek. On the cheek. Answer is changed. Answer is no more Bell's palsy. It is Ramsay Hunt syndrome. Okay. Ramsay Hunt syndrome. ठीक है. Patient will be expressionless where we have the palsy. Take a look over here. There is no expression. Everything is going on this side only, right? Even he is able to lift the only this much cheek, and there are expressions. Over here, no expressions. Okay. रामसे हैंड सिंड्रोम में क्या मिलेगा? बेल्स पाल्सी प्लस रैशेस ऑन द चिक और बुल्लाज ऑन द टिम्पैनिक मेम्ब्रेन. ओके, इसी को बोलते हैं हर्पिस जोस्टर ऑटिकस, राइट? ऑटिकस, रामसे हैंड सिंड्रोम और ऑटिकस सेम है. What is Melkerson syndrome? What is going to happen in this? Lower motor neuron lesion plus swelling of lip. Okay, and swelling हो गई. देखो यहाँ पर lower motor neuron lesion with swelling on lips, specifically upper lip. Okay, with fissured tongue. Okay, there will be deep cuts. इसी को हम बोलते हैं fissured tongue. Is called as Melkerson syndrome. क्या बोलेंगे सर? मेलकेरसन सिंड्रोम. ठीक है, क्या होगा आंसर यहाँ पे? ठीक, चलो पूछा जा चुका है ये. What is this? An instrument which is attached without wire. Okay, no wire going inside the canal is called as BAHA, bone anchored hearing aid. Okay, bone anchored hearing aid. किस में देंगे? One is in front of you. There is no hole in the ear. So where we will use? The problem present in the external auditory canal or external ear. In that diseases, इसमें प्रॉब्लम कहाँ आ रहा है? कंडक्टिव हेयरिंग लॉस में प्रॉब्लम आ रहा है. सो एनी डिसीज विच इज गोइंग टू कॉज कंडक्टिव हेयरिंग लॉस, वी विल यूज बोन एंकर्ड हेयरिंग एड. एग्जांपल्स: bilateral conductive hearing loss, otosclerosis, external auditory canal atresia, absent external auditory canal. What will be the contraindications? Diseases present in the inner ear, sensory neural hearing loss, right? उसका और इसका कुछ लेना देना ही नहीं है. If inner ear is not working, and if you are going to put a instrument which is going to be used as conductive hearing aid, काम ही नहीं करेगा, right? Inner ear खराब है. And remember this, less than 5 year, and if bone is thin, जहाँ पे हम लगा रहे हैं वहां पे bone अगर thin है, we cannot put this. So what we will do, instead of drilling in the bone, what we will do, we can give soft band. Right, बच्चों को बैंड पसंद आते हैं सभी. We will give soft band. Even if you can appreciate, like look over here, it is external auditory canal atresia. Take a look. छोटा सा ईयर है, कंप्लीट ईयर नहीं है. External auditory canal atresia. Over there, till patient become 5 year and bone thickening increases, we can give soft band hearing aid. Right? Then comes this one, All the images of this hearing aids has been asked. Okay, जितने भी मैं बताऊंगा. A machine connected with a single wire. Okay, machine with a single wire is called as what? Anyone? Now problem is in the inner ear. Problem is in the inner ear. Okay, cochlear implant. Okay, cochlear implant. So SNHL को रिप्लेस करेगा, राइट? कब होगा? Meckel's aplasia is the contraindication, right? And if disease is present inside the brain, SNHL मतलब sensory neural hearing aid act करना है, so brain should be function, right? Then only this device can act. But if the problem is in the brain, of course we cannot put a implant, right? Reason being, brain में problem है, nerve में problem है, so this is not going to replace the cochlea, right? So there will be sensory neural hearing loss even after we will put the implant. Reason being, nerve and brain is gone, right? कब यूज करेंगे? Uses bilateral sensory neural hearing loss, right? The contraindication of BAHA are the indications of cochlear implant. And एक क्वेश्चन आता है, ट्रिकी है. No improvement in hearing. Okay, in hearing even after putting BAHA, bone anchored hearing aids. ये इंडिकेशन थे BAHA के. Okay, but there is no improvement. Improvement ही नहीं हो रहा है. That means problem यहाँ पर तो था, लेकिन now problem has started in the inner ear. So of course what we will give cochlear implant. ठीक है. फिर आता है ABI. Now problem is in the nerve. Nerve के अंदर problem था, head nerve में problem है. Now what we will do, we will put a implant which is going to act directly on the brain. Which is going to act on directly on the brain. Implant with 2 wires. Okay, implant with 2 wires. एक मशीन होंगी, एक माइक्रोफोन होगा, and this will be the transmitter. So implant with 2 wire is called as AVI. कहाँ यूज करेंगे? Implantation on the brain. That was all about ear. You want me to continue or should I take tomorrow remaining part? No problem. Up to you. This